Hey, Mrs. Drent. My speech is on heart attacks, and this is my audience. Have you ever wondered what it would feel like to have a heart attack? Well, many of us don't actually ever want to know. We are interested in learning about what causes heart attacks and how to prevent them. Today, I'm going to inform you on the symptoms of heart attacks, what is different about heart attacks in men and women, and how heart attack can be prevented. First, you need to know what a heart attack is. A heart attack occurs when blood flow to a part of your heart is blocked for a long enough time. That part of the heart's muscle is either damaged or it dies. The effects are low flow of blood. That means that less oxygen gets into the heart muscles. This lack of oxygen can quickly damage the blocked off section of the heart. If oxygen isn't restored quickly enough, that section of the heart can die. This will result in permanent damage. Scar tissue will form in place of dead heart tissue, then lead to irregular heartbeat or failure. This could be caused by coronary heart disease. Coronary heart disease is a condition in which a waxy substance called plaque builds up inside the coronary arteries. These arteries supply oxygen-rich blood to heart. Heart attacks most often occur as a result of CHD. This is also called CAD, coronary artery disease. These clots can grow so large that the artery becomes completely blocked, leaving your heart without blood or oxygen. Also, your artery can rupture from blood clots. There are many symptoms people experience when having a heart attack. The main one is chest pain. Many people think of this as the main symptom, but to really know if you're having a heart attack, you have to consider the other symptoms. These symptoms are sweating, anxiety, shortness of breath, and pain down the arm, neck, or jaw. So if you feel a discomfort in the chest, arms, neck, jaw, or stomach, call 911. Many people will confuse what they think is a heart attack for angina. Angina is not a heart attack. It is pain in the chest that happens when the same part of the heart does not receive enough blood temporarily. You can rest for a few minutes and be relieved of the pain. If you are diagnosed with angina, you will have a greater risk for a heart attack. Secondly, people have to wonder, is there a difference in men and women when having a heart attack? The answer is no. There really is no difference. It mainly depends on your body type. Men and women will both have chest pain, shortness of breath, indigestion, and anxiety. Heart attacks are a leading killer in men and women. In 2003, 427,000 men died from heart attacks. There were around 226,000 women that died the same year from heart attacks. Heart attacks may occur during sleep or while resting, if there is a sudden increase in activity, or after a sudden severe emotional or physical stress, including an illness. There are many ways to prevent heart attacks. You could lower your cholesterol, keep your blood pressure low, exercise, eat a healthy diet, maintain a healthy weight, control diabetes, and quit smoking. All of these can be changed if you would take the time to change it. You will be diagnosed with a heart disease by having an electrodiogram hooked up to you to watch your heart rate and rhythm. There also will be many blood tests. Lastly, when you have a heart attack, you think there is nothing that can save you, but there is. There are medications and treatments. Medical experts say the best thing to take is aspirin, and it works to stop a heart attack. This aspirin is also called antiplatelet. This helps keep your blood from clotting. Another main medication is beta blockers and ACE. They are inhibitors to help protect the heart. Also, statins are used to improve cholesterol levels. Some treatments include being hooked up to a heart monitor to look at how the heart is beating, taking oxygen so your heart doesn't have to work so hard, IVs, and nitroglycerin and morphine to reduce the pain. In conclusion, each year 1.2 billion people have heart attacks and many die. Of those people who die from heart attacks, about half die within an hour of the first symptoms and before they reach the hospital. Anyone having those symptoms should call 911 right away and not wait. Many of us don't want to know how it feels to have a heart attack, so take care of yourself and remember the symptoms and what to do.